Okay, guys, so before I can talk about secondary exercise addiction and how it relates to eating disorders, I want to spend most of today's class talking about eating disorders. And then Thursday's class, when you have a great foundation for eating disorders, we're going to focus almost primarily on secondary exercise addiction. So that's the order of things. Let's go. Let's talk about some statistics. I always like, as you guys know, to contextualize a topic that we're talking about in some kind of statistics so you get a sense of the scope of the problem, who suffers from it, that kind of thing. So let's talk about that for a moment. Eating disorders usually onsets in adolescence for the first time or early adulthood. Rarely before, that's a new word, guys, before. Rarely before puberty, although there have been in more recent years cases of subclinical, as we call it, eating disorders, or even full-blown eating disorders. Subclinical meaning individuals begin to show some of the symptoms, but not enough to reach the level of a clinical diagnosis. There have been studies in more recent years indicating that between the ages of even 10 and 13, and even 9 sometimes, we're seeing disordered eating habits. We're seeing dieting behaviors that increase risk for eating disorders. Anorexia, as we'll talk about a little bit later in class today, has an earlier on average age of onset than bulimia. But in general, more individuals are diagnosed for the first time with eating disorders sometime around or after puberty. 90% of the cases are diagnosed in ages less than 20, okay? Somewhere below 10% occurs before the age of 10, roughly, and the age of onset seems to be earlier for women than for men. Now, there is a little bit of diagnostic bias, and there's a lot of literature on whether or not we're missing eating disorder behaviors in men. Having said that, there have been some more recent data on males with eating disorders as well as females, although the age of onset for women tends to be earlier than it is for men. As many as 10 million women and 1 million males in the United States are said to suffer from an eating disorder, typically either anorexia or bulimia. We will also talk about binge eating disorder. I did talk a little bit about that already, though, when I talked about food addiction. So I'm not going to spend as much time on binge eating disorder since I talked a lot about that already with regard to food addiction, but I may mention it throughout the course of our discussion. Around 25 million have been said to struggle with binge eating disorder. Now, all of these numbers, by the way, are probably underestimated because people are often too ashamed to seek treatment or to report their symptomology. So there may be people who are either not coming to the attention of clinical diagnosis or are subclinical, as I said before. Many individuals study with body dissatisfaction and, like I said, subclinical disordered eating attitudes and behaviors and problematic dietary patterns. 75 to 80% suffer for somewhere between 1 and 15 years. 6 to 20% will die as a result of their disease. I'm petting my dog. He decided it's time to come and get involved and not let me finish my video. I apologize for that. I'm trying to pet him while I finish this segment. Females between the ages of 15 and 24 who suffer from anorexia in particular, which we will talk about in more detail today, have a mortality rate, so a death rate. Listen to this, guys. This is pretty powerful. That is 12 times higher. Did you hear me? 10, 12 times higher than the death rate from all other causes of death combined. Anorexia nervosa has the highest premature fatality rate of any form of mental illness. In other words, premature fatality. People are dying earlier than they would otherwise on average die as a result of these anorexia eating disorder symptoms. Rates of diagnosed eating disorders have doubled, it's estimated, since the 1960s, so 4 decades ago. Increases in rates of anorexia in young women aged 15 to 19 has occurred in each decade since 1930. So what's that telling you? That's telling you, and actually even more, did I just say 4 decades ago? It's even more than that. We're in 2020. What am I thinking? That's insane. Wow, way more than 4 decades ago. Rates of eating disorders have doubled since the 1960s. Every decades since the 1960s, right? 70s, 80s, 90s, 2000, 2010, 2020. 6 decades ago. 6 decades ago, not 4 decades ago, 6 decades ago. Anyway, since 1930, we are finding an increase in the rates of anorexia in women between the ages of 15 and 19. And every decade since the 30s, we're getting increases. Incidence of bulimia, which we will also talk about today in women aged 10 to 39. I want to mention bulimia, we have been seeing and we are seeing women beyond puberty, well beyond puberty, some showing even at midlife in their 40s and 50s, showing symptoms of bulimia. These rates of bulimia in women aged 10 to 39 tripled between the year 1988 and 1993, and it's been going on ever since then. So before we get started on the diagnoses, I want to mention some things. It's hard for people who don't have eating disorders to envision a circumstance in which eating, which is not only obviously a requirement for life and for health, but often an enjoyable activity for most people, can become a problematic, even life-threatening experience for some. Eating disorders in the college populations as well, in particular, has become more prevalent in the U.S., so much so that, believe it or not, and I hope you've never experienced this if you've lived in the dorms, but there were studies indicating that in colleges and universities around the country, there were vomit signs posted in women's bathrooms in the dormitories to remind women to literally clean up after themselves after purging their food as a result of an eating disorder. There were even some reports in interview data, anonymous interview data, that buckets and cleaners were provided for female students in dormitories, in female floors, on female floors of female dorms, or female floors of mixed gender dorms. I can't talk. You know what I mean. Dorms that have both men and women in them. That because of the prevalence of self-produced vomiting and purging as a result of eating disordered activities and behaviors, there were actually signs reminding women and cleaning supplies to clean up after themselves. That's pretty disturbing. So before we move on to the next set of slides, keep these data in your head to get a sense of the severity of the problem and the wide age range within which these eating disorders are diagnosed, and the fact that they can lead to early death. And I'll see you on the next slide.